from the last module that we didn't cover, so you should have a colored 2-page copy of that from your handout in that. So it's nothing new, we just didn't cover it. Okay, so let me go over schedule changes. So did you all get a listing of your, okay. So I had Monica and Jessica this morning get additional SPs, so they worked really hard on this, and we got 6. So, and we're doing you in pairs, so you'll each have an hour. Everybody happy? Anybody not happy? Okay, good. I hope that gives you sufficient time. Professor Bean and I will be over there. We will keep the schedule going, we will keep things moving so everybody gets the same amount of time, and we can answer questions and help you. Okay? Okay, good. All right, so we're dropping medication history taking. It was an in-class exercise, not graded, wasn't going to be on the test, and of all the things I can let go, then I let that go. Okay? So tomorrow morning, 8 o'clock is, 8 to 10 is physical diagnosis. We're going to do meter teaches first. Okay? So be in here and ready to go because we're time limited. I'll do a brief overview of here's how we do it. Then, depending on how many, I haven't looked at the box yet, but we will practice on whatever we have. We'll use whatever we have. I'm not sure how many meters I have. Last year we had enough for everybody to be in a small group and do them if they wanted to. Then at 9 o'clock we'll do foot exams. So you're going to hear some from me today, you're going to hear it tomorrow, and when Maria Jones comes in and with physical therapy, she has an awesome, I've looked at her PowerPoint, she's going to talk to you about it again because physical therapists tend to do the debridement and wound care. So you'll hear it from her, and then you'll finally do your PBL tomorrow afternoon. So you're going to get it about 3 times. And then I moved, she has to leave by 11:30, so I'm going to move the insulin cases to 12:30 to 2. We'll finish a little bit before 2, so the first group can get over there and start at 2. Okay? It's an in-house, I mean it's an in-class activity, it's graded. You'll be in groups and we'll work through cases. Okay? But you'll have to write group answers, which I will grade. Okay? And then you've done the SP practices, so that's the rest of the week. Then we're done with that except for diabetes on first thing Monday morning is Dr. Britton. He'll do the integrated case. And then I think diabetes ends. Okay? Everybody got it in your brain what we're going to do? Okay. I hope that adjustments give you and addresses the concerns you've had and the complaints you have voiced. If not, let me know. Okay, so let's pick it up with neuropathies. Okay. Neuropathies I find one of the most difficult of the complications to deal with. It's hard to prevent. And people can have acute symptoms. If their sugars get high, they will have neuropathic symptoms. You can get their sugars down, those should resolve. But they can become chronic and persisting, and it is very difficult then to get rid of them entirely. It is a very hard pain to manage. There aren't very good treatments with it. The only saving grace is that eventually the nerves burn out and the symptoms go away, but you are then insensate and you lose sensation. So that's the bad side, but the pain does eventually go away. It's an awful pain for people to deal with. So prevention is so important. Foot care goes along with that because remember Amy Hughes told you yesterday that the lesions and disease and infections that are furthest from the heart are the hardest and the slowest to heal? Well, the foot falls in there. It's the furthest away from the core of the body. It has the longest nerves, and they are the most vulnerable. And that is where most of the neuropathy show up, is in the feet. You can have it in the hands. You see it there? Stocking gloves, easiest way to remember. It's the most common distribution, most common presentation. People can have foot neuropathies, but not in their hands. So it can affect their hands to where they can't pick something up, can't pick up like little things like coins I have seen are really hard for them to pick up. If they were used to working with their hands, I've had several women who were like needle pointers or their crochet, they can't do it as well anymore. I had a man who was a car mechanic, and just to give you a sense of how much your nerves protect you and pain protects you, car mechanic spilled battery acid on his hand and didn't realize it. Didn't realize it. It burned part of his hand away. Had another man, I've had several of these happen, with neuropathic feet, is I had a guy who was moving on Thanksgiving Day, he was moving a pot, something he had cooked, boiling water, trying to move it to the sink, spilled it on his feet, didn't realize it, and took all the skin off of his feet and toes, lost part of his foot. Had a guy right at the end before I left family medicine, he came in one morning and he goes, I got something wrong with my foot, I want you to look at it. So he took off his shoes and his socks, and his skin was just hanging off in rolls. I mean, it just looked like somebody had taken a knife and just kind of had started to take it off. He had spilled coffee at church the day before. It must have been a Monday. I was in clinic. So he'd spilled hot coffee on his foot, and it just took all his skin off. And he didn't know it. I had to beg him to go to the hospital, and they admitted him. They wanted to amputate his foot, and he left AMA, so I don't know whatever happened to him. So I'm telling you, that is why it's so important that they be educated about, get good blood sugar control so you can maintain that nerve protection. But if you lose it, you really have to talk to them about how do you now take measures to protect those areas of your body that are insensate. Okay. So those are dramatic, but I can't tell you how many times I've taken off shoes and there are terrible ulcers. Dr. Britton had one where he took off the shoe, terrible ulcer on the leg. We got them all set up, referred, but they fell through the crack. They didn't keep an appointment. Somebody then canceled them, and within 6 months, the patient lost their foot. The lady who I told you yesterday about the psoriatic arthritis, she had the psoriatic plaques all over the bottom of her feet. The only way I figured it out is she was limping I always watch them. I have the patient walk in ahead of me, and I'm following them, and I'm watching how they walk. So she was limping, and I said, what's wrong with your, she goes, nothing. I said, okay, well, I want to see your feet. So sometimes I have to coax them into showing me their feet. So when she took off her shoes, she just had slash marks all over her feet. I said, what did you do? And she said, well, I used scissors to cut these plaques off because they bother me and I can't get rid of them. So that we were able to heal up. I had another lady, Amy Hughes told you yesterday, just a small injury to the leg set up an ulcer. Had a woman, her A1C at the time I saw her was 15%. She worked in a nursing home, and a patient just bumped her with her wheelchair. That was it. She said it bruised, but within a week it had ulcerated. And it took 18 months, she was a smoker, it took 18 months to heal that ulcer up. I thought she would lose her leg, I really did. But the wound care people, my hats are off to them. They are some awesome folks. And they saved her leg. They worked with her, and she did do everything they asked her to do except quit smoking. And we got her blood sugars down to about 7%. But they saved her leg. So really, really important. It is so hard to get these things healed up once they set in. They're really difficult. So prevention is everything. So let's see. So when to screen. Again, with type 2s, it's right away. If you can't do it the day you see them, then the next visit that you see them, you should do a test to test for sensation, for vascular status, and look at those feet. Dr. Britton should tell you about some of the patients that he's had. He had a guy who wore boots, And I have found that sometimes men, as they get older, and if they live by themselves, can't necessarily get, and they get big tummies, they can't get their shoes off. So this guy, I don't know how long he had not taken his boots off, but when Dr. Britton finally got them off, his toenails had grown up, around, down, and back into his toes. Yep. So, and there, Sophie was asking me about nail disease that goes along with diabetes, and it does, because there's, I was tell them about that guy.
I heard my name because I thought I would just.
Yeah, I never say anything bad about you. Tell him about the guy with the toes and the nails that had grown back into.
Oh, this was just.
How long had he not been able to get those boots off?
Months. It's even better than that. He was from Okemah, and he was a deputy sheriff. And he had been living with a girlfriend. He was probably about 70-something years old. Had a girlfriend who lived with him, and they got into a fight, and she left him. Well, she was the one who always took his boots off and put them back on. And so he lost his boot remover. Said he had no relationship going on. So they've been on for like months. I figure maybe 6 or 7 months, or maybe even longer than that. So he slept. I said, "Do you sleep in the boots?" I sleep in my chair. Had the boots on. So I finally got them off, and I said, "Well, I'm gonna need to look at your feet." So we pulled these things and tugged, and when the boots came off, there were these toenails that had all just grown around, and they were growing up. They had not gotten into the flesh from his toes, but it was like it was any day now. They were going to get in the way. And I figured his boots kind of protect his feet. And I said, "Do you cut your toenails?" And he said, "Well, obviously never did them." And he said he always had somebody else do it. He wasn't even overweight. A lot of times overweight people can't bend over to get to their feet, but he was fairly lean as far as I remember. I don't remember him being particularly overweight.
Okay.
I just think he just couldn't, he had a hard ability to kind of bend over and get down there. So we had to cut his toenails off, and he didn't have any damage yet, but it would have been rough, so we had to go get the clippers. I remember that, and I remember how hard they were, and I wasn't going to trim his toenails down to specifications because I just wanted to send him to a podiatrist because he has those really thickened toenails. I mean, they must have been, quarter inch, half inch. I mean, just tremendously hyperkeratotic nails. They kind of curved over. So you had to really kind of work hard and put some power on there. And there were 2 students in the room with me, and I wanted to just get the toenails clipped off so that they wouldn't get back into his flesh, and then we scheduled to go to the podiatrist to get the rest of his toenails trimmed off. And when I had to kind of really get on that, clamp down on one, it came off, and these 2 students were women. Just don't take it as a sexist comment, but it flew across and hit one that screamed. I just started the video, but I was saying, "Okay, get back." It's a true story.
Tell me about Ms. White. I was telling about how people could fall through the cracks, and she was the one wasn't she the one that got the ulcer on her?
Oh, yes.
Yeah.
Oh, goodness. This lady she was high risk for hypoglycemia because she had neuropathy, and she ate bad. She's the one who would eat Indian tacos, but her favorite thing was funnel cakes. And she would make funnel cakes, which she was just sugar fried, and powdered over. They'd be this big, and I'd say, "Well, tell me what size." So they were always like this big. I figured they were, that she was probably getting several thousand calories of fat and sugar periodically, fairly often. Well, anyway, she had neuropathy, she had out of control diabetes. She just would go for months, year, not do anything. Finally decide she'd do something, be in perfect control. She'd take her medicine, then she'd just be off again, just cycle like that. Decide it wasn't good. But she had an ulceration on her foot. The very beginnings of one, it wasn't that bad. I took her over to